You wake up at 2:17 in the morning with chest pain, and before you ask, "Am I dying?" you ask something more American. "Am I covered?" You do not call 911 first. You open your insurance app. You check the nearest emergency room, whether your plan accepts it, how much you must pay before insurance helps, and whether one wrong hospital could turn one bad night into a bill that follows you for years. And somewhere across the same city, another person feels the same kind of pain. Their doctor answers on the second ring. A car is arranged. A private entrance is opened. Their cardiologist is notified before they arrive. No one asks them to prove the pain is worth treating. No one asks if this is the right facility. No one hands them a clipboard while they are trying to breathe. Same organ, same fear, same city, completely different healthcare system. Stay until the end, because the real privilege is not the private room. It is being believed before your body has to break. This is how healthcare treats you at every level of wealth. Level 1. When care becomes a price you avoid. You do not think of yourself as uninsured every minute of the day. You think of yourself as careful. Careful when the kitchen knife slips. Careful when the cough lasts too long. Careful when your tooth starts throbbing on the right side and you chew on the left side for 3 months, like that is a treatment plan. At this level, healthcare is not a place you go. It is a price you avoid. You have a job, maybe two. Neither one gives you benefits, or your hours got cut just low enough that the company does not have to offer coverage. You looked at marketplace plans once. The monthly price looked possible for about 12 seconds until you saw how much you still had to pay yourself. So you close the laptop, you tell yourself you are healthy, you tell yourself the swelling will go down, and sometimes it does. That is the dangerous part. The system trains you to gamble because enough small problems disappear on their own. Then one does not. The fever comes back. The tooth infection reaches your jaw. The chest pain becomes too scary to bargain with. You go to the emergency room because legally, the emergency room has to keep you from immediate danger. That wording matters. Not cure, not protect, not follow you through the next 6 months. Keep you alive enough to leave. You sit under fluorescent lights with a plastic wristband around your arm. A nurse asks for your insurance card. You say you do not have one. Her face does not change much. She has heard it all night. She is not cruel. She is tired. The computer just moved you into a category. Self-pay. That sounds almost dignified, like you are choosing independence. It really means every charge has nowhere to go except toward you. The blood test has a price. The scan has a price. The doctor who speaks to you for 4 minutes has a price. The facility has a price just for existing around you. You do not know the prices when you say yes. You are scared. Weeks later, the bills arrive in separate envelopes from names you do not recognize. The hospital, the physician group, the lab, the imaging company. One visit turns into a small mailroom of debt. According to the KFF 2024 analysis of medical debt, people in the United States owe at least about $220 billion in medical debt. KFF also reported that uninsured adults are more likely than insured adults to struggle with healthcare costs. These are not rare edge cases. This is a financing system sitting next to a medical system, and at this level, it reaches you first. You call the billing office. The hold music plays. A voice tells you there may be financial assistance. You ask how to apply. They send a form that asks you to prove how poor you are after the hospital has already proven how expensive it can be. You gather pay stubs, bank statements, tax forms, proof of address, proof that you are not hiding money from a bill you never had the power to understand. The body was treated in 4 hours. The bill takes 6 months. This is the first truth of healthcare in America. Being uninsured does not mean you get no care. It means you get care late, under pressure, through the most expensive doorway. Preventive care would have been cheaper. A primary care visit would have been easier. Antibiotics early would have cost less than an emergency infection. But prevention requires access before panic, and panic is the only form of access many uninsured people can still count on. At this level, you are not a patient in the way the commercials use that word. You are a balanced due with a pulse. Level 2. Insured, but still afraid to use it. You have insurance now. That should feel like safety. And for a moment, it does. There is a card in your wallet with your name on it, a group number, a member ID, a logo in the corner. You can show it at the front desk and stop saying, "I do not have insurance." But then you use it. The plan has a monthly bill you can barely afford and a deductible. The amount you pay before insurance really starts helping. $3,000, $5,000, sometimes more if it is a family plan. The insurance exists, but it does not fully wake up until you have paid enough pain out of pocket. This is the level that confuses people, because from the outside, you are insured. From the inside, you are still negotiating with your body. Your knee has been hurting for weeks. Just a slow grind every time you take the stairs. The doctor examines it, recommends an MRI, and says the words that begin the second illness. Let's see what your insurance says. Not, let's see what your knee needs, what your insurance says. A few days later, the answer comes back, denied. The plan wants physical therapy first. 6 weeks of it. Maybe that makes medical sense. Maybe it is just cheaper. You cannot always tell, and that uncertainty is part of the trap. You are dealing with pain inside a system where every medical decision may have a money shadow behind it. So you go to physical therapy twice, then stop because the copay is $60 per visit and twice a week turns into $480 a month. You stretch at home, you buy a brace, you walk differently. Your hip starts hurting because the body is not a spreadsheet. When one line item gets ignored, the next one absorbs the cost. The Commonwealth Fund 2024 Biennial Health Insurance Survey found that nearly 1 in 4 working-age adults who were insured all year still did not have enough coverage. Among them, 57% avoided needed care because of cost, and 44% were paying off medical or dental debt. That is the part people miss. Insurance is not just protected or unprotected. It is a question of how much financial damage has to happen before help feels available. At this level, you start learning the vocabulary of delay, deductible, co-insurance, your share of the bill, prior authorization, asking permission before care. Out-of-pocket maximum, the most you pay in a year if the rules are followed. In network, the doctors your plan prefers. Allowed amount, the price your plan recognizes. These words do not sound emotional, but they become emotional when you are sick. A deductible is the reason you wait until January becomes March. Prior authorization is the week your anxiety sits beside you at dinner. In network is the difference between a bill you can survive and a bill that follows you for years. You call the insurance company. The representative is polite. They tell you the claim was processed correctly. You ask what that means. They read the sentence again with slightly different spacing. The claim was processed correctly. Correctly does not mean affordably. Correctly does not mean humanely. Correctly does not mean the care made sense. It means the machine followed its own rules. This is why underinsurance feels so personal, even when it is not. No one has to insult you. The system simply places a price in front of each next step and waits to see how badly you want to continue. At this level, you are not ignored completely. You are acknowledged conditionally. Your pain is real, but only after you pay enough. Your diagnosis matters, but only after permission. Your care exists, but only if you can keep paying tolls on the road toward it. You are not a patient yet. You are a claim number trying to become one. Level 3. A patient in a queue. Now the card works more often. You have a full-time job. The plan is not generous, but it is real. Premiums come out before you see the money, but at least you can book a primary care visit without feeling like you are stepping into a financial ambush. This is the level where healthcare begins to look functional from a distance. You have an annual physical, you have a pharmacy benefit, you have an urgent care center that costs less than the emergency room. You have an online portal with lab results and a message button that may or may not reach a human, and for normal problems, this can work. Sinus infection, rash, flu test, blood pressure refill, stitches from a kitchen accident. The system can handle you when your needs fit inside the standard box. The problem is what happens when they do not. You find a lump, or your heart starts racing at random times, or the stomach pain keeps coming back. Your primary doctor listens, orders a referral, and tells you to see a specialist. The specialist has an opening in 9 weeks. 9 weeks is short enough for the scheduler to say it casually, but long enough for your mind to build a life around fear. You go to work while a second version of you runs worst-case scenarios in the background. You ask if there is anything sooner. They say you can call for cancellations, so now you have a new part-time job, calling to see if someone else got sick in a more convenient way. At this level, the healthcare system is no longer closed to you. It is just slow. And slowness has a cost that does not always show up on the bill. You lose sleep. You spend lunch breaks on hold. You use paid time off for appointments that last 17 minutes. You get a lab bill for $186 because one test was covered and another one was not. The billing department says the code was different. The code. There are few phrases in American life that can make a person feel smaller than being told their body was coded incorrectly. This is also where the employer enters the exam room. You keep the job partly because you need the insurance. You tolerate the manager, commute, and schedule because quitting does not just mean losing income. It means losing the network that knows your prescriptions, your doctors, your pending referral, your child's therapy appointment. Healthcare becomes a leash disguised as a benefit. Some employer plans are excellent. Some people have caring managers and enough savings to absorb the gaps. Number 9. But for millions of Americans, the job is not just a job. It is the door handle to the medical system, and that changes how free you feel. Here is the first useful rule. If your healthcare depends on your employer, your emergency fund is not only protecting rent, it is protecting your ability to keep care going. This is where building wealth becomes more than wanting nicer things. A few months of cash can be the difference between making a career decision and staying trapped because your next prescription is tied to your badge. This is the first real turn in the ladder. You are no longer outside the system. You can get care, appointments, prescriptions, but every step still asks you to prove patience, paperwork, and schedule flexibility. At level 3, you are a patient. But you are a patient in a queue. Level 4, when care finally starts early. Something changes when the plan gets better. Not everything. You still fill out forms. You still wait sometimes. You still get bills written in a language that seems assembled to be misunderstood. But the friction drops. You work for a stronger employer now, or your household income lets you choose a better plan. The deductible is lower. The network is wider. The copays do not make you pause before booking an appointment. You can see the doctor before the problem becomes unbearable. That one sentence is more important than it sounds. You can see the doctor before the problem becomes unbearable. This is where healthcare begins to shift from rescue to maintenance. Your back hurts, so you book physical therapy early. Your cholesterol is high, so you follow up before it becomes a crisis. Your doctor says a colonoscopy is covered, and instead of putting it off for 2 years, you schedule it. Your child needs an evaluation, and you have enough options to push, call, switch providers, and keep moving. The doctor may not spend more time with you because you are more worthy, but the system gives you more ways to return, clarify, test, and follow up. That is how health compounds, not magically. Not because wealthy people are biologically better at healing, it compounds because small problems are caught while they are still small. A $40 copay today can prevent a $4,000 emergency later. A covered screening finds something early. A medication is adjusted before the side effect becomes a hospital visit. The healthcare ladder is not only about treatment, it is about timing. Poor people often meet the system at the point of crisis. Stable people meet it at the point of concern. Wealthy people meet it before the problem fully forms. That is the hidden staircase. At this level, you begin to experience choice. Not total choice, but enough to feel different. If one doctor dismisses you, you can try another. If one office has a long wait, you search the network. If a medication is too expensive, you ask about alternatives. You are not begging the system to open, you are navigating it. That difference changes your voice. You speak more directly. You bring notes. You ask what would make this urgent, what the next step is, and what should happen if symptoms continue. And because you are able to return, the doctor can practice better medicine. Follow-up is not a luxury in theory, but in real life, it often behaves like one. The best medical advice in the world is weaker when the patient cannot afford the next visit. Good insurance does not make you rich. It does not protect you from every denial, surprise bill, bad doctor, or terrifying diagnosis. But it gives you something level 1 and level 2 rarely have. It gives you room to act early. There is a quiet dignity in that. No private entrance, no luxury clinic. Just the ability to treat a health problem while it is still a health problem, before it becomes a financial event, a work event, and a debt event. At this level, you are not just processed, you are manageable. The system believes your problem is worth handling before it becomes expensive for everyone. Level 5, when inconvenience becomes a fee. At this level, You start noticing that healthcare has shortcuts. They were always there. You just were not close enough to see them. You have a high income now. Maybe you are a lawyer, software engineer, executive, business owner, consultant, or dual income household with strong benefits. The plan is better. The health savings account has money in it. The yearly limit on your own costs is annoying, but not life-changing. A $900 bill still irritates you, but it does not change what groceries you buy. That is a different relationship with medicine. You do not ask, "Can I afford to know?" You ask, "How soon can we find out?" The appointment that used to feel optional becomes automatic. Dermatologist for the mole, orthopedist for the shoulder, cardiologist because your father had issues, therapist because stress is starting to leak into sleep. You are still busy. You still wait for some specialists. But now you can pay cash when the plan is inconvenient. You can see a doctor outside the network once and absorb the cost. You can choose the brand name drug for a month while the insurance approval catches up. This is not yet private medicine. This is the level where inconvenience stops being a wall and becomes a fee. There is a huge moral distance between those two things. For someone at level 2, a $700 imaging bill can end the conversation. For someone at level 5, it may be a bad afternoon. Same scan, same machine, same radiologist. Different consequence. And because the consequence is different, the medical path is different. This is also where the system becomes more attentive in ways that look like care and business at the same time. A specialist's office offers a cash pay opening sooner than the insurance-covered appointment. A private lab sells extra tests. A clinic has a coordinator because people at this level are expected to pay. Some of it may be useful. Some of it may be unnecessary. Some of it may be expensive anxiety dressed up as prevention. That is the new risk. At lower levels, the danger is too little, care too late. At higher levels, the danger can become too much care with too little clarity. Money opens doors, but every open door has someone standing behind it with a product. The rich are not only protected by the system, they are also marketed to by it. So the decision rule is simple. Pay for speed when delay changes outcomes. Pay for clarity when uncertainty is costly. But be cautious when someone sells you fear without explaining what you would do differently with the result. This matters because build wealth culture often talks about money like it only buys freedom. In healthcare, money buys options, but options require judgment. A full body scan can find something important, or it can find a harmless shadow that leads to 3 more tests and a month of panic. At level 5, the system no longer sees you as a burden. It sees you as a buyer. You are not fighting to be treated. You are deciding which treatment, which office, which test, which timeline, and which bill is worth accepting. That feels like power. It is power, but it is also the beginning of a more sophisticated sales funnel. Level 6, when the doctor answers back. The first time your doctor texts back, it feels almost illegal. Not the office, not the portal, not a nurse triage line that says someone will respond within 2 business days. The doctor. You send a message at 8:40 at night about a symptom that would have turned into a spiral at level 3. At 8:52, your phone lights up. Try this tonight. If it gets worse, call me. I can see you tomorrow morning. There are people who go their whole lives without hearing healthcare speak that way. Concierge medicine changes the ratio. Fewer patients per doctor, longer appointments, same day or next day access, annual membership fees that vary by city and physician. Some practices still bill insurance. Some are cash only. Some focus on primary care. Some orbit around longevity, and people who want the body treated like a high-value portfolio. The core product is not medicine. The core product is responsiveness. At this level, the waiting room shrinks. The appointment stretches. Your doctor knows the medication that made you dizzy last year. They remember your mother's cancer history. When the lab result looks strange, you do not spend the weekend refreshing a portal. Someone calls. This is what the rest of the system often pretends to be: relationship-based care. There is nothing inherently wrong with it. Many doctors enter medicine wanting exactly this: time to know patients, time to think, time to prevent, instead of reacting all day inside a 15-minute schedule. The uncomfortable part is that the version of medicine many people imagine as normal has become a premium product: a doctor who knows you, a phone call returned quickly, a visit long enough for the second concern, the one you were embarrassed to mention at first. At level 6, you see that American healthcare did not forget how to be personal. It rationed personal attention through payment models, staffing shortages, insurance contracts, and time pressure, then sold some of that attention back through membership. The patient experience changes because the doctor experience changes. This is not a story where every regular doctor is careless and every concierge doctor is a saint. Often it is the same doctor, trained in the same schools, making different choices inside different constraints. In a standard practice, the day may be cut into tiny blocks. In a concierge practice, the panel is smaller and there is more margin to breathe. The compassion did not appear when you paid, the capacity did. And capacity is what patients feel as kindness. This level creates the first major emotional climax of the ladder, because the difference is no longer only financial, it becomes bodily. Your sleep improves because uncertainty does not have to wait until Monday. Your symptoms are not necessarily less serious than before, but the silence around them is shorter. At this level, you are not a claim number. You are known, not completely, not without limits, not outside the economics of the arrangement, but known enough that your fear has a destination. Level 7. When healthcare starts before symptoms. Now healthcare begins before symptoms. That is the shift. At level 1, you wait until the pain wins. At level 3, you wait for the appointment. At level 5, you pay to move faster. At level 7, the system invites you in while you still feel fine. Executive health programs are built around this idea. One day, sometimes two, inside a major hospital or elite clinic, blood work, imaging when appropriate, cardiac evaluation, lifestyle review, specialist access, a coordinator walking you from room to room so you do not have to navigate the maze yourself. The experience can feel almost unreal if you remember the lower levels. No clipboard repeated 6 times. No explaining your history to 5 different people who have not read the chart. No wondering whether the next office knows you exist. Someone has arranged the day around your body. Your body has an itinerary. The hospital does not call it luxury. It calls it complete, preventive, organized, efficient, and often, those words are true. Executives use these programs because time is expensive. Companies pay for them because losing a key person is expensive. Wealthy families use them because uncertainty is expensive. The system becomes proactive when the person attached to the body is valuable enough to the people paying. This is where the moral texture gets complicated. Early detection is good. Coordination is good. Prevention is good. No serious person should argue that a wealthy person deserves worse care just because others lack access. The problem is not that level 7 exists. The problem is what its existence reveals about the lower levels. It reveals that delay is not inevitable. It reveals that scattered care is not destiny. It reveals that the same hospital capable of losing your referral for 6 weeks can also build a one-day testing plan when the payment structure and the patient category justify it. This is the line viewers should sit with. The healthcare system often knows how to move quickly. It just does not move quickly for everyone. At this level, you meet a heart doctor before the scare. You meet a food and health specialist before diabetes. You meet a physical therapist before the injury becomes surgery. Your risks are mapped before they become a diagnosis with a billing code. This is why wealth improves health in ways that do not look like money at first. It looks like a calendar. It looks like an appointment that happens this month instead of next quarter. It looks like a second opinion before treatment, not after regret. It looks like a care coordinator who knows which specialist is available, which test matters, which records are missing, and which office needs to be pushed. At level 7, you are not healthier because your body is more deserving. You are healthier because your risk gets managed earlier. The system does not wait for you to break. It starts looking for cracks. Level 8. When medicine becomes part of your life. At the highest levels of wealth, healthcare stops looking like an institution you visit. It becomes support built around your life. You may still use major hospitals. You may still need surgeons, specialists, scans, pharmacies, and insurance paperwork somewhere in the background. But the visible experience is different. There is a private physician who knows the family, a nurse available for travel, a specialist network that can be activated with a call, medical records organized before anyone asks for them. Second, opinions arranged across states, sometimes across countries. The appointment does not begin when you arrive. It begins when someone on your team makes the call. At this level, The most valuable service is not the nicest room. It is translation. Medicine is complex, even for smart people. A cancer diagnosis can come with multiple treatment paths, hospitals claiming excellence, genetic tests, clinical trials, side effects, insurance approvals, and decisions that have to be made while the family is terrified. Wealth does not remove the terror, but it can buy interpreters for the terror, not language interpreters, system interpreters. People who know which surgeon sees the most cases like this, which trial is real, which hospital brand is famous, and which department is actually best, which specialist will return the call, which treatment is standard, which is experimental, and which is expensive hope. That kind of navigation can change outcomes. It can also change the emotional experience of illness. The wealthy still get bad diagnoses. Their children still get fevers. Their parents still decline. Their bodies still betray them. Money does not make death negotiate forever. But money can remove many of the humiliations that surround sickness. No begging for an appointment. No repeating the story to a new stranger every time. No choosing between a scan and rent. No waiting for a mailed denial letter to find out whether the next step is allowed. At this level, healthcare becomes less like a maze and more like a staff meeting. People gather, options are presented, timelines are compressed, records move, the family is briefed, a plan forms. This is not because the disease respects wealth. Disease does not care. Cancer cells do not check net worth. Arteries do not read tax returns. A virus does not pause at the gate of a private neighborhood, but systems do check wealth. Systems check payment source. Systems check big donor relationships. Systems check employer plan. Systems check whether this person has a family office, an assistant, a company, a foundation, or a name that makes someone upstairs answer faster. And here is the final inversion. At the bottom, you have to convince the system that your pain is real. At the top, the system assumes your discomfort is worth preventing. That is a different kind of medicine. At level 8, you are not a patient in a waiting room. You are a life the institution organizes itself around protecting. Not because your life is worth more, because your relationship is. Now go back to the beginning. It is 2:17 in the morning. Someone is awake with chest pain and a phone in their hand. They are not thinking about health policy. They are not thinking about KFF reports, or Commonwealth Fund surveys, or the architecture of American medicine. They are thinking, how much will this cost? That question should not be the first symptom, but for millions of people, it is. And this is why the healthcare ladder is more disturbing than the banking ladder. When a bank treats you differently, your money moves differently. When healthcare treats you differently, your body may age differently. Your pain may last longer. Your diagnosis may come later. Your family may meet the worst version of a disease that could have been caught in an earlier chapter. That does not mean every poor person gets bad care or every wealthy person gets saved. Real life is messier. A brilliant doctor in a crowded clinic can change someone's life. A rich patient can receive unnecessary treatment. A cheap plan can cover exactly the right thing. A premium system can still fail, but exceptions do not erase the pattern. The pattern is this. The less money you have, the more healthcare asks you to wait, prove, postpone, appeal, and endure. The more money you have, the more healthcare starts to prepare, organize, explain, and respond. That is the ladder. Not sick to healthy, not poor to rich. Unbelieved to believed, delayed to prioritized, processed to known, stabilized to protected. So here is the practical question, not as medical advice, but as a life design question. Where is the weakest link in your access to care? Is it no coverage? A deductible too high to use? No primary care doctor? No emergency fund? A job you cannot leave because your medication depends on it? A family history you keep ignoring because the test feels expensive? A plan you have never actually read because the language makes you want to close the browser? Pick one weak link and make it less fragile. Find the urgent care your plan accepts before you need it. Know how much you pay before insurance helps. Ask your employer what happens to coverage if you leave. Keep a copy of your records. Price the prescription. Build the medical emergency fund if you can. Use the preventive visit if it is covered. Do the boring thing before the terrifying thing. That is not a full solution to a broken structure, but it is how individuals buy a little time inside a structure that often sells time to the highest bidder. Comment with the level that feels most familiar to you. No insurance, weak insurance, employer plan, good insurance, premium access, concierge care, executive medicine, or private medical team. And if you have ever delayed care because of cost, say what made you wait. That is the part of the system people need to hear out loud. And if this video helped you see healthcare differently, subscribe. This channel is about the hidden rules that decide who gets leverage, who gets delayed, and who gets protected. Because the body is the same body at every level, the pain is the same pain, the fear is the same fear. The healthcare system does not change at every level of wealth. It reveals who it was built to answer first.